Good morning. I'm Reverend Kim James from First United Methodist Church in Marriott Slaterville, a suburb of Ogden. Our church congregation moved out here about 12 years ago, but we are this year celebrating our 150th anniversary of ministry to the Ogden area. I'm here with Bill Tibbitts of Crossroads Urban Center, and we are going to share with you some thoughts about child homelessness in Weber County. Bill's going to give his statistical report in a bit, but first I want to explain to you some thoughts about why I, as a Christian person, care about this issue of child homelessness. As a Christian, I come to this issue, first of all, from the teachings of Jesus found in the Gospels. For example, in Matthew 19, we read, "Then little children were being brought to Jesus that he might lay his hands on them and pray. The disciples spoke sternly to those who brought them. But Jesus said, 'Let the little children come to me and do not stop them, for it is to such as these that the kingdom of heaven belongs.'" Jesus, an important teacher and leader of men, did not dismiss, ignore, or blame children and their parents. Instead, Jesus welcomed them to come to his attention with their needs. As a United Methodist, I also come to this issue of child homelessness from the perspective of Methodist founder John Wesley. In England, in the 1700s, John Wesley took great interest in helping to support orphans, establishing several orphanages in England and encouraging his fellow preachers to do likewise in the American colonies. The same was true for the establishment of schools by Wesley and the early Methodists. Today, I can speak about child homelessness from my own life experience. In 2005, my husband and I adopted two siblings from the country of Colombia. They were ages 6 and 8 at that time, and our children had already suffered immensely from the ill effects of poverty, hunger, abuse, domestic violence, and homelessness. While my husband and I and all the community supports we could gather around us did everything in our power to try to heal the trauma our children had suffered, the sad reality became apparent to us that early life homelessness wires a child's brain and shapes their perception of reality in negative ways that are very hard to change later on. Today, our 23-year-old daughter is struggling to pass one of 4 GED tests in the hope that she can get a better paying job. She works full-time and still avoids homelessness only because we parents assist her financially every month. Likewise, our 22-year-old son is barely satisfying his probation requirements enough to stay out of jail. We all like to hear and retell the success stories of those exceptional persons who defied the odds and rose up to a better life. But from my personal experience, I know how hard our family has tried. I know how hard the school teachers and counselors tried. I know how hard psychiatrists and medications and how many we tried. I know that my young adult children are still trying to the best of their ability. And yet the seeming inability of my children to rise above the trauma of their formative years is proof to me that as a society, we dare not let our little children suffer these traumas. It is a false hope to think that one day later on, these young people will be able magically to correct and heal on their own at a much lower cost to society. The costs of intergenerational poverty, chronic homelessness, incarceration, and other social services are huge. No governmental entity likes the ever-rising budgets of these programs, but I want you to hear that investments in corrective and systemic action on behalf of our homeless children is essential. It's the moral and smart thing to do. And now Bill is going to give you the Weber County homelessness report.
Thank you so much, Reverend James. as somebody at Crossroads Urban Center, I'm lucky enough to work at an interfaith mission institution of the United Methodist Church. And so I really think, I mean, I know I'm incredibly lucky to be able to meet people who, you know, have that same faith and that same ethical guidance on things like child homelessness, but also that they put it into action and do things like collect diapers for homeless kids and collect food for the hungry, and actually help do things like talk to state legislators and county council members, county commissioners about issues like this, so that there won't be the need, as many people who need help in future years. And that's really what this report is about. I think before I say anything about what we found in the report, it's really important to mention that this year has been an exceptionally and extraordinarily hard year for homeless kids. We've had a pandemic that has made many families afraid to go to a shelter because they're afraid that if they're around that many people that they'll catch a virus and have a potentially life-threatening illness. That has in turn contributed to people staying in unsafe situations for longer than normal. And so we've seen all around the state a surge in police calls about domestic violence incidents. And so I think, you know, it's been a very tough year for children to be homeless. I think one other factor that way that is worth mentioning is that we've had 2 school years disrupted. You know, their kids had their school year end early last year, and then a lot of kids are doing remote learning either all the time or part of the time. And this is a particular hardship for kids who are living in a shelter where they don't necessarily have the best internet access or a quiet space where they can go and be with a tablet if they are lucky enough to have a tablet. So I think kids who are homeless are already at a high risk of falling behind. Having 2 school years disrupted the way last year and this year have been disrupted puts those kids at higher risk. That being said, you know, this pandemic is unprecedented. We can't really say what we learned the last time this happened and make recommendations about that. So instead, what we decided to do was to look at the longer term problems, because I think from our perspective, the need to act on those longer term problems is more pressing now that we see the kids who are falling behind are at risk of just getting lost in long-term ways. I mean, I think, you know, it's so with that being said, I think we'll look at what we did find. And what we found is that there are hundreds of families with children who become homeless in Weber County each year. During the last 3 years, there were 1,568 people and families with children who received homeless services in Weber County. 461 of those people who were from families and who got homeless services in the last 3 years were children aged 6 and younger. And I think the research is really clear that that being homeless is a traumatic event for children generally, but that the trauma has more long-term impacts on younger children. That those first 6 years are really important developmentally, and so having a period of homelessness with really young children is it creates long-term problems, both health problems, emotional problems, educational attainment problems, and this. Unfortunately, the national research shows that the time when a child is most likely to be homeless in our country is during the first year of life. And so infants actually have the highest rate of homelessness of any single group in the country. And I think it's important to keep that in mind. And both that there are lots of very young children falling between the cracks and that those children are facing long-term impacts that we'll have to deal with down the road. The other thing that we thought was worth looking at was how often families are returning to homelessness, and how often families are staying in a shelter for a longer time. Last year in Weber County, there were 15 people and families with children who were homeless for 6 months or longer. And I think, and then there were 54 families in Weber County who became homeless at some point in 2019, and that incidence of homeless was the fourth or more time that they had become homeless during the past 3 years. And so, you know, there are families that are staying in the shelter for most of the year. There are families that are returning to the shelter for fourth, fifth, sixth times. And I think, you know, when you talk about the impacts of child homelessness, these families that are returning to homelessness multiple times, these families that are staying in the shelter for extended periods, those are the most vulnerable, the most in need of support, which is something we talk about in our recommendations. It's also, and there's also research showing that the negative impacts of homelessness on infants and children are likely to become worse with the greater the duration of the period of homelessness. And so that's why it's important that there are kids who are in the shelter for 6 months and working to make it so that doesn't happen. Because I think kids are resilient, they can recover from trauma, but you can't recover from a trauma that's ongoing or that keeps repeating every time you start to feel better. So speaking of trauma, though, I mean, homelessness is a traumatic event for children. It has long-term impacts, but it's also something that can arise from trauma or make someone more likely to be exposed to other forms of trauma during their period of homelessness. And so on the night of the 2020 point in time count for Weber and Morgan counties, there were 23 children who were living in a shelter for survivors of domestic violence. We don't know how many children were in a domestic violence shelter during the entire year, because that data is kept private. But on the night of the point in time count, we know that there were 23 children in a domestic violence shelter. We also know that since the beginning of the pandemic, police departments across the state have seen a surge in calls about domestic violence. So this is, it's just important as we move forward to be aware that there are a lot of kids who are going to need support. The other thing we learned is that homelessness impacts children's performances in school. There were, the school districts in the state have identified 4 times more children who are homeless than those who've received homeless services. They have a more expansive definition, but I think it's really important to realize that there are a lot of kids who have unstable, unpredictable housing situations, and those are kids we need to think about in terms of moving forward after the pandemic has disrupted 2 school years. The research is really clear, though, that being homeless definitely has negative impacts on long-term educational attainment. Kids who have an experience of homelessness are up to 9 times more likely to be held back in school for at least 1 grade. There's other research showing that if you get held back for a grade, you are significantly more likely to drop out of high school. And so I think we need to be very concerned that children who are already at risk of being held back a grade, dropping out of high school later in life, have now had 2 school years disrupted. And so we really need to be aware of that and start working hard to identify the kids who've fallen behind and helping them to catch up, or at least not fall further behind. So, which gets to our recommendations. Our first recommendation is that we need to produce 30 units of supportive housing for families with extended and repeated experiences of homelessness, the ones we were talking about earlier, who've been in the shelter for 6 months or longer, or have returned multiple times to shelter. I think we have in Salt Lake County, we've had some really positive experiences with permanent supportive housing for chronically homeless adults. I've seen people whose lives have been saved, people whose lives have been changed because they were able to move into that kind of housing. That being said, that housing is based on a national model that really is for adults, largely in their 40s and 50s, who have long-term mental health issues. It's not designed for the needs of a 19-year-old single mom who was homeless for most of her pregnancy. It was even less designed for the needs of her child, right? And so what we need is supportive housing that's child-centered, that's connected with, that has on-site childcare if possible, that has a good relationship with local schools, and has needed medical services on site, right? Here in Salt Lake County, we have a couple of our permanent supportive housing projects, our newer ones, that are working to have nurses and social workers check in on people to see how they're doing. I think with Medicaid expansion, it's possible to do that. That should just become the way we do things generally with supportive housing. And I think when you're talking about young kids with trauma, having, age appropriate people check in on them to see how they're doing, it's going to pay off in the long run. So that's our first recommendation. Our second recommendation actually is also related to Medicaid expansion, because our Utah opted into full expansion on January 1st of this year. And that creates an opportunity to address one of the reasons that families become homeless multiple times. And that would be that often, if a family shows up at the shelter a first time, second time, there's not been a consistent way to check in on people to see how they're doing. And with Medicaid expansion, there can be teams that that's part of what they do, is they meet, they check in on people to see if they're able to maintain their housing. I think, and if their mental health needs are being met and various other things, I think ideally that's not going to work if you don't actually enroll people in Medicaid while they're at the shelter and connect them with their managed care provider so that they know what services are available. I think a lot of parents, if they find out that being homeless has been traumatic for their kids and that there are services that can help them recover from that trauma, they will sign up, but they're not going to sign up for that on their own because they don't even know that exists, right? And so it's not good enough to enroll kids and parents in Medicaid. We actually need to have them meet with somebody who can tell them like what services they might need and what services are available to them. And so I think that's an opportunity, and we should take advantage of it. And then I skipped a recommendation. Our second recommendation was actually to create a Weber County Housing Affordability Commission to coordinate regional efforts to address housing affordability and reduce homelessness. In 2018, the legislature created a state housing affordability commission. We think it would be a smart thing to create a county level commission to identify needs and to come up with plans for fulfilling those needs. The state really can't bring that discussion down to the local level. The county can. So our fourth recommendation is something I talked about several times during this presentation, and that is coming up with a way to help the kids who families are being impacted by the pandemic. There's been some rental assistance programs that the state has put into place to help reduce family homelessness and homelessness in general during the pandemic. Those need to be continued as long as the pandemic's going on. But we also need to really get as many people as we can to come together and come up with a plan for finding the kids who've fallen behind in school because of the pandemic and reaching out to them and helping them to stay connected or resume connection to the schools. I mean, I think here in Salt Lake where I work, there's been this real problem where thousands of kids have just not enrolled in school this year because the Salt Lake School District is all online. And so you have, I mean, so there's just a real need to find those kids who are falling behind. Those are our findings. Those are our recommendations. We have invited every state legislator who represents Weber County to listen in on this presentation about what we found. We also invited the members of the Weber County Commission to listen in. We're going to follow up with them after the presentation and make sure that they get a copy of the report and offer to meet with them. We have a project here at Crossroads called the Coalition of Religious Communities that brings people together from every faith background that's cares about child homelessness to talk to legislators about and county level leaders about this issue. I think you're absolutely welcome. If you haven't heard of the Coalition of Religious Communities, or which we call CORC most of the time, go to the Crossroads Urban Center website and sign up for our email list. We have the report. This report is also available. The full report is available on the Crossroads Urban Center website at www.crossroadsurbancenter.com/report. So that is, I would encourage you to read the report, and if it speaks to you, help us educate your elected officials about it so that we can act on all or some of these recommendations.
So, Bill, thank you for presenting that great report to us. And I want to encourage everyone to take a good look at it, to read it, because you've given us a lot of facts and our brains don't retain those very well. So in print will be better. I want to screen share and show a pile of diapers that we've been collecting here at my church. I just wanted to show this off. We've been collecting diapers here at Ogden First United Methodist Church throughout this month of September. And we'll probably have some more gathered in by the end of the month. And we're going to take these diapers to the YCC here in Ogden. That's the domestic violence shelter. And we have learned from Bill about the statistic that the time in life when a person is most likely to be homeless is the first year or first few years of their lives. And we know also that domestic violence causes families to become homeless. And so we are doing our part here at First United Methodist Church to help out with the diaper drive. But I also know that diapers and things like this can just be patches on wounds. And we need to work together in a systemic way to help prevent child homelessness. This is going to require all of us working together with our great minds and our political resources and putting our heads together so that we can imagine a better way to change the system that causes child homelessness. Diapers and food and domestic violence shelters and all those things are a help. They're needed, but we need more. We need to figure out ways to prevent child homelessness from the get-go. And so I really encourage you to take advantage of this report that is available at crossroadsurbancenter.org and look it up and print it out and use it. Use it in your churches, use it in your council meetings, use it in your commission meetings, use it at the state legislature, use it wherever you do your public service, and help us in the name of God to make a difference for our kids. Thank you for sharing this time with us today.
Yeah, thank you so much.